filler. End of the... Someone commented on one of my things the other day and said, we like when Dr. Emer's cracking up at the beginning of the videos. I said, that's because I'm laughing before they go live and then I get really serious. So I'm laughing a little bit because we cut out. Did it work?
It ended randomly.
Oh,
sorry.
There we go.
That was weird.
We're doing it on purpose. Okay, 1 second. We'll be there 1 second.
Wait, can you
People tune
close
in.
the app out?
Yeah, my
and
bad.
then
This is what happens when you go live. This is why people don't like to do live TV anymore.
Alright.
Now ready?
We're good.
Okay. Hey guys, Dr. Emer. We're in West Hollywood. End of the day on Friday, and usually we call Filler Friday because we're always doing some sort of filler or laser on Fridays because that's when people have their time for downtime. We have a young patient of mine who's very smart because he wants to think of his face long term, what's going to happen, what he's looking for. He likes more fullness and chiseling to the overall face. So we're using a filler called Bellafill. I'm going to show you guys this. I know I've shown it numerous times. And if you look in there, it doesn't look like any other traditional fillers because inside is a particle called PMMA, polymethyl methacrylate. When in the news is very scary, but when used in real life and real practice, small amounts of this acrylic polymer in a collagen-based gel can build collagen really nicely. And what it's approved for in the United States right now is soft tissue filling, fine lines and wrinkles, kind of the nasolabial folds. When we first started doing this, we were doing chins and noses to build collagen long term because this lasts 5 to 10 years. And in someone young like this, who has little asymmetry in his face, this is great for just fine contouring and enhancement without anyone knowing that anything's done. Plus he's gonna get so much more value because you know fillers nowadays can range from $500 to $1,500 a syringe. For that similar type of cost, you can get this and it lasts 5 to 10 years. The negative to these types of fillers is if it grows and you don't like how it looks, you can't reverse it. So that's the problem. So you gotta go to an expert, which is what he does. So we look at his face, and I'm gonna show you, and everyone's gonna say he's a baby face, and I guarantee you on Instagram, everyone's gonna tell me I shouldn't be doing fillers on him because he's so young. But take a look, he's got a nice chiseling here, but lack of volume because he's got definition. And on the other side of his face, and it's even apparent in the lower part of his face, on the other side of his face, he's more round. Some is genetics, ethnicity, etc. So what we're gonna do is give him more volumization here with mid-face lifting and a little bit more detail-oriented contouring or enhancement on the other side. So smile again, I wanna see again. So here's the nice elevation he has there, but not as much here, relax. So we're gonna go onto the bone and just do a little bit. And nothing crazy, just a small amount. And just so we can get some more of that definition. Now with this filler, unfortunately, it's better, it's actually a lot easier, although you can use a cannula. It's a little bit easier to fine tune with a needle, is what we're doing here. We're just trying again to build that definition part here. Just a small amount, great. Hold that right there for me with your left hand. Go ahead, just lightly. I'm gonna touch on real quick. Come over and switch this. And then we're gonna go to the other side while that goes in over there. Is anyone saying anything or asking anything, commenting?
yeah.
Really? Very rare. It's very rare. So the filler again is comprised of a synthetic acrylic polymer base with a collagen carrier. And the reason it has that collagen carrier is it allows, just do a little bit here, it allows for the product to go in really smoothly and build nicely within the tissue, because if this is done correct, you'll get a nice scaffolding effect and it will build collagen long term. The other benefit he's going to see is in a little bit in scarring. He has some dilated pores and some scarring here that will also improve smile. Perfect, relax. So now we'll do a little bit more into the direct fat pads, slightly, small bits. Again, this needle is a little bit bigger. Give me a gauze there, hold with your right hand, nice and firm, right there. Good. Take this really quick. Thank you. Let go for a second, hold again, right there. Good. Give me a second, we'll go back to the other side. So, I'm gonna take this down. Good. So now you can see with a little bit more of that elevation, nothing major, but again, this is gonna build over time. So I'm gonna do continue it there. Just fine tuning that a little more. Anchor points, perfect, hold right there. Now we're gonna go back to here. And I always tell people, typically hold that. Usually you bleed and bruise a little bit more from the Bellafill because we're using a stronger needle. Smile again, relax, and wait, as long as you go slow, and do small aliquots, which is called microdroplet injection. You can build a nice scaffold here that will build over time for him the collagen that he's looking to build.
Does it hurt? How does it feel?
How does it hurt?
That's fine. A little bit discomfort, but not major.
And guys always bleed a little more, so don't freak out. You see blood dripping down like that. Hold right there for me. Just do firm pressure for a couple minutes. That's it. We're done. We're gonna wipe him off. Go and grab some gauze with alcohol for me. I'm gonna throw this out behind you. And then we're just gonna show him now with the Bellafill. I'll give you that real quick. With the Bellafill, you don't see as much of a difference immediately, although there's volume, because it's going to go down slightly. And then it's going to integrate into the tissue. Go ahead and let go.
Can you grab somebody grab the mirror?
Give me one without any alcohol now.
What do you want to do?
Hold right here
Hand
again.
it to her.
Okay, so let's grab the mirror if you can behind. And then let's show him. Just going to grab here. But overall, there's a little bleeding on the right side. Overall now, smile a second, hold on, hold it here, good. A little bit more facial balancing, a little more volume here, and then you see how now we have some definition laterally here. So the swelling will go down, it'll integrate, create a scaffold, and lift that area, and it should even out. Now again, asymmetry is still a sign of beauty, and it's important not to fully symmetrize, I don't know what the word is, make someone symmetrical, because it can make them look unnatural. So we're working with his natural anatomy. He's a younger looking guy, small enhancements for long-term improvement. That's Bellafill for cheek contouring. Thanks guys. Cool.